it can manage various oral health concerns such as caries management and dentinal hypersensitivity in a wide range of patients. So it could be adults, it could be children, and we're going to go into who is our target audience and who would benefit from fluoride varnish application a little bit later on. Fluoride works in different ways to minimize demineralization or manage caries, essentially, as well as manage dentinal hypersensitivity that is caused by open dentinal tubules or exposed dentinal tubules. Fluoride can also be effective in reversal of early tooth decay, and this is very, very important. And patients are often so surprised to hear about this because they think as soon as they have decay or they have a cavity, they need to have a filling. And if the lesion has cavitated already and has spread to the dentine layer underneath, then of course they need a filling. But in the early stages, as long as the demineralization process or that radiolucency on your X-ray is within the enamel layer and it hasn't spread to the dentine layer underneath, we can actually reverse that process. And during that process, the tooth will start to demineralize, but as it remineralizes with fluoride ions present nearby in the biofilm, it makes fluorapatite, which is of course stronger and more resistant to dissolution by acids. But with the Profil fluoride varnish, there is an element, there's an ingredient in Profil which is called dimethicone, and that's going to help it stick to the surface layer a bit better, and it's going to help cover those dentinal tubules a bit more effectively to offer enhanced protection from sensitivity. So it goes a long way in providing long-lasting protection from dentinal hypersensitivity by sealing those tubules with minerals and providing continuous release for a period of time. Incorporating fluoride varnish application in regular dental care routine is an effective preventive measure for maintaining your oral health and dental health. So let's focus now on the Profil fluoride varnish and what it does, how it works, and some of its benefits over the competitors in the market at the moment. So the Profil fluoride varnish contains 5% sodium fluoride, that's 22,600 parts per million fluoride, and the gel is quite mucosa friendly. The good thing and the unique thing about this from a patient perspective is that there is flavor variety. So the flavors could be berry, could be mint, or it could be unflavored. Another crucial thing that I love about Profil is that no pre-cleaning or drying is required. And this is going to result in a significant reduction in clinical time required. And it really streamlines that clinical workflow and that you don't need to clean the teeth or dry the teeth to get the maximum benefit from this fluoride varnish. It is alcohol free, so when it's applied, the patients don't tend to experience a burning sensation or that soft tissue irritation because some of the products out there can have alcohol, and that can not only kind of dry out the mouth slightly, but it can also cause a burning sensation or a bit of irritation to the soft tissues. It has a dimethicone gel base, which adheres to the tooth surface really, really well for several hours, and it continues to release fluoride ions for up to 24 hours, which is amazing because once you've applied this, then this is going to continue to work for a number of hours. It's not going to wash away straight away. And that dimethicone gel that just makes sure that it adheres to the surface of the tooth and it can continue to release those fluoride ions for up to 24 hours. This is what the product looks like. So this is the single dose blister, and it's amazing because you have the exact amount of fluoride that you need. Patients really like the consistency of it. It doesn't clump. It's a transparent gel that just glides onto the surface of the teeth. In conclusion, if we sort of recap everything that we've covered about fluoride varnish, we know that application of fluoride varnish is an essential step in preventive dental care, not only for adults, but also for children and for those who are high risk of getting tooth decay. So thank you so much for your time and for listening. And yes, I hope you have a lovely day.